To TV5 News at 9, it is time now for Aging in Style with McLaren. Joining us this morning is Emily Williams. Thank you so much for joining us, Emily. You know, it's a difficult time right now, and the world is changing, and it's taking its toll on the mental health of the elderly. Why is it so difficult right now for seniors?
Hi, Colette. Thanks for having me. Yeah, it is a little bit more difficult than normal right now. The things that we used to do for stress relief or our coping mechanisms, some of them may not be available to individuals anymore with the stay-at-home order that's in place and the social distancing that is required. Things like going to the gym or going to have coffee with friends, visiting with family, friends. So those support systems, they're not as readily available as they used to be. And those stress relieving things that we used to do, we might not be able to do those at home.
That's for sure. Now, are there some symptoms and signals that we should be looking out for, Emily, with those, our elderly loved ones?
Absolutely. So feelings of sadness, helplessness, hopelessness, any physical symptoms of stress, anxiety, like shortness of breath, racing heart, any change in appetite or sleep, whether we're eating too much or too little, or sleeping too much or sleeping too little, are all signs that we should be on the lookout for.
Now, Emily, if they're experiencing these symptoms, these signs, what do they need to do to cope, to help?
So some things that individuals can do at home would be, talking to a supportive person over the phone or FaceTime, Zoom. There's a lot of different creative ways out there right now. And just slowing things down, prioritizing responsibilities and just taking one thing at a time. Set aside self-care, whether that be exercising, eating well, sleeping, things of that nature. And then also challenge yourself. For every negative thought you have, challenge that with a positive thought.
Oh, I love those ideas. Now, when is it the time that you say, hey, maybe someone needs to seek additional care, additional help? How do you know?
Good question. So if these symptoms are persistent, despite trying some of those things I just mentioned, then you would definitely want to reach out to your primary care provider, and they can help assess the situation further and put you in contact with a specialist if needed.
Oh, that's great. Now, can you tell us about some of the programs that you have for elderly, those people that are out there that are really struggling right now? Because it's a difficult time. What programs are available for them?
So here at McLaren Bay, we have an inpatient psychiatric unit for older adults, 55 and older. We specialize in treating individuals with psychiatric disease and or individuals who have dementia with behavior changes. We also have an adult behavioral health unit for individuals 55 and under, for individuals suffering with psychiatric disease. Those are both inpatient units. We do have our partial hospitalization program, which is a day program. We are able to provide social distancing there, and we have been keeping our numbers below 10 to help facilitate that. But that's a nice program where you go from 9 to 3:30 every day to help work through some of these issues that you might be facing during this time.
Emily, anything else that you think is important that we can do to help our elderly loved ones just cope during this pandemic? Because it's very stressful for everyone.
Just don't be afraid to reach out. Talk to a supportive family member, friend. You can also always call the National Suicide Hotline if you feel like you need immediate help. Don't hesitate to call our behavioral health unit to be put into contact with the right place. And our number at our behavioral health unit is 989-894-3911.
Oh, some great information. Thank you, Emily, so much for giving us all those tips. We appreciate it.
Thank you.
You are welcome. Now, if you at home want more information, check out the Aging in Style page on WNEM.com.